Thank you everybody for coming. I'm going to start with updates on COVID-19. COVID cases are going up again. We have an incidence rate of about 217.2 per 100,000. As of March 22nd, Washington State is in recovery phase 3. We'll stay in this phase for the next 2 weeks, and then DOH and the governor's office will be reevaluating. As of Friday, March 26, 34,405 vaccines have been administered at the Town Toyota Center. 3,427 vaccines were administered last week. 917 were second doses, 694 were part of our equity clinic, and 1,816 from our public clinic. As of March 31st, tomorrow, individuals will no longer need to verify eligibility through FaceFinder. Testing operational hours are changing to Monday to Thursday, 11 a.m. to 7 p.m., and Friday, 9 a.m. to 5 p.m. If you have received a first dose last week and you did it before that time frame, make sure that you register. If you don't get an email reminding you to register, please show up in person starting between 11 to 7 p.m. with the new hours. The outreach team has reached out in person to individuals with language and technology barriers at various packing sheds, Mexican bakeries, restaurants, and grocery stores. The team also provides COVID-19 vaccine information to address key vaccine hesitancy. Total people scheduled through the outreach team for last week was 580. CAFE also registered an additional number of individuals who came in. If you are an essential business and would like to pre-register your employees, please contact Chelan-Douglas Health District outreach at 509-886-6487. As of Wednesday, March 31st, those in Phase 1B, Tiers 3 and 4 will be eligible for the COVID-19 vaccine. That includes people who are 16 years or older with 2 or more comorbidities or underlying conditions. All people 60 years and older, people, staff, and volunteers in certain congregate living settings, agricultural workers, correctional facilities, group homes for people with disabilities, settings where there are people experiencing homelessness, and high-risk critical workers in certain congregate settings, restaurants, food services, construction, and manufacturing. This also includes all the previous tiers as well. And so if you're a healthcare worker or 65 and older, you can also come in and get your vaccine as well. Just want to say a big thank you to all of our community partners, National Guard, Department of Health, Confluence Health, Lifeline, Town Toyota Center, all our clinical partners who are working in the communities, Columbia Valley Community Health, Cascade Medical, Lake Chelan Community Hospital, a lot of our pharmacy partners as well, and big thank you to CAFE and outreach partners in the community. Confluence is partnering with Parque Padrinos and others, and just want to say a big thank you to them. We have reached about 42% of our population in Chelan-Douglas Health District has initiated the vaccine, which is a phenomenal rate. That's about 12% higher than the national average for initiation. And so that's a big accomplishment. And I just want to say a big thank you to all of them. Follow Chelan-Douglas Health District on Facebook and Twitter, Chelan-Douglas, or at Chelan-Douglas HD for updates. Keep up the 4 W's and help stop the spread of COVID-19. Wear a mask, wash your hands, watch your distance, and sign up for WA Notify. And now we're going to open it up to questions.
Ken Terry Anderson from High School Broadcasting. That's a big jump in COVID cases from last week, 170 to 217. Is this consistent with other areas of the state, and are you worried about this sending us back to phase 2 or even further back?
So we're seeing a large increase in our younger populations throughout the area, specifically with youth events and with bars and restaurants. And we are concerned that it is going to push us back a phase. And we're asking people to continue to wear masks. That is a very functional, useful way to do it, and we're asking that people continue to wear their masks.
So that review of those numbers, is that the 2 weeks that you talked about with the State Department of Health? That is the sort of the timeline on when you're expecting, if we're still above 200, that's when we would go back?
I believe that April 17th is the date that the governor stated, and so they'll be looking at the previous 2 weeks before that. So we still have an opportunity to drop the cases if people wear masks and do prevention.
So in June and July, we have cherry season coming up, where we're going to have a lot of people working, and they work together. And a survey was done, and 36 people were asked if they would get the vaccine. 35 said yes, 1 said no. And what could we do? What would happen if the one that said no to the vaccine spreads COVID-19 to the rest of the team?
So right now we are seeing that Pfizer and Moderna are extremely effective at actually stopping transmission. And so if 35 out of the 36 individuals are vaccinated, that would be enough to interrupt transmission and not have it pass between the group. A lot of times when we think about vaccination, we talk about herd immunity. So if you have 96% coverage, that is very, very good.
The question was, considering that amongst our workers, most of them are men, and they're afraid of the shot, being poked. She's wondering when, or this group is wondering when the vaccine, Johnson & Johnson, will be arriving. And she referenced the 35 people who get vaccinated and the herd immunity. So with the Johnson & Johnson, 35 vaccinated, would that be considered herd immunity?
Yeah. With the 96% kind of group that's vaccinated, even with Johnson & Johnson, it provides significant amount of herd immunity to protect the workers. So
when does Johnson & Johnson arrive?
And Johnson & Johnson, more doses will be arriving in April, and we're expecting the vast majority of it to be arriving in May. We're also seeing that there is a bit of an interruption in terms of the supply chain from the federal government. There's a difference between what they say is going to become available and what they're forecasting for us. And so we're hoping to get more clarity from them in the next couple of weeks.
Oscar Rodriguez from the Wenatchee World. Could you tell us a little bit about breakthrough cases, or how people might, there's some people that have been fully vaccinated 2 weeks later after the second shot, and somehow still get COVID. Could you tell us a little bit about that and what maybe the Department of Health is doing to look into that?
So when you hear 94% efficacy or 75% efficacy, the 6% or 25% in that non-efficacy group, those are groups that are at risk of breakthrough. And as vaccine is in the population and as variants change, the breakthrough, it could lower the efficacy of these different vaccines. Right now what we're seeing with Moderna and Pfizer that CDC has been reporting, as the efficacy group, you expect to have 6 or 25 out of 100 people have breakthrough cases. But when you start to see more through our surveillance programs or people being hospitalized or other, then we know that the vaccine's efficacy is dropping. So this is why it's important for us to continue to get tested, especially with COVID-19 being in our populations. And the Department of Health and local health jurisdictions are going to be working to do surveillance to track to see these breakthrough cases, to see if the efficacy of these vaccines is dropping. But right now, all the indicators look really, really good.
It says here in your update today that as of March 31st, Phase Finder will no longer be required. And it says that removing Phase Finder will help reduce barriers for eligible individuals. Can you explain that? Are people getting scared by Phase Finder?
I think it has less to do with fear and more with confusion. Am I eligible? Am I not eligible? Part of the reason that Phase Finder is being phased out is that it takes them about 2 weeks to update in 32 different languages. And so it's not able to keep up with the changes that are happening with how quickly we're moving through the vaccinations. And specifically with the comorbidities, it's really challenging to track each one of them or have people understand what the comorbidities are. And so we're taking away that requirement for Town Toyota Center and other areas so that people who believe that they have 2 comorbidities can come in and get a shot and they won't be turned away. And we're still asking that individuals who do not have comorbidities or are fairly young and healthy go ahead and just wait just a little bit And that way we can reduce the amount of people who are at risk of going to the hospital and or getting very, very sick if they contract COVID.
We are a month and 2 days away from everybody 16 and older getting eligible for the vaccine, in addition to the already large influx of people coming tomorrow. What is your level of confidence that the health district will be ready for this large group of people, and what do you need to do over the next month to increase that level of confidence?
So right now and in a month, we're still have an uncertainty in terms of our vaccine supply. And so with our, we are still planning and in the process of hiring and bringing on additional teams and increasing access points for vaccine distribution. So it's our plan by May 1st to have multiple sites open in Chelan and Douglas counties that will be able to do higher volume. So if we do have the vaccine arriving in May, as the federal government is promising, we'll be moving through those populations much quicker.
The CDC released a press release yesterday mentioning that first dose vaccinations have around maybe 80% effectiveness. Is there any consideration from the state or maybe from the local health department about maybe changing the strategy so as to maybe focus on first doses rather than guaranteeing that everyone that does get a first dose gets a second dose as well?
One of the things that we've seen with the longer term studies for Pfizer and Moderna specifically, the 2-dose vaccines, is that you have that 80% effective protection until you get that second dose. But if you don't get that second injection within the time period, that 6-week time period, that 80% protection drops significantly. So it's really essential that we continue with the 2-dose strategy. That way we don't see 6, 12, or 18 weeks from now a huge spike in cases of people who got a single dose.
So in the Hispanic community, there's a lot of hesitancy because the vaccine was put together or built like in a year, and there's hesitancy in not trusting. They're not trusting the vaccine. So we're going to have places for people to be vaccinated. We're going to have the vaccine, but if there continues to be hesitancy, what is the health department going to do to address that?
We are working very closely with some of our health equity partners, and we're preparing to do another CASPR study in order to research and understand people's ideas around the vaccine hesitancy, the different reasons why they don't want to get the vaccine. And we'll be adjusting our messaging to make sure we address those fears and do more education and outreach within the community. And while Moderna and Pfizer are new technologies and they were rapidly developed this last year, the mRNA mechanism which they use allows for that speed and is very effective and has been proven to be very safe. And the risk of getting COVID-19 and becoming very sick versus fear of a vaccine that's been shown to safe and effective, we want to make sure that people understand what the difference is and how they can protect themselves. And as well, the Johnson & Johnson is an older technology, and it's also incredibly safe and effective. So we'll be putting out more messaging in the future related to those to educate the population on these different types of vaccines.
So we have a question from Facebook. It's an inquiry on extra doses at the vaccine site, and is it true that local pharmacies are giving away vaccines?
So starting tomorrow, we're expecting a much larger uptick in vaccine uptake as we move into the next phase. And we're also doing booster shots from the last 3 weeks of primary doses. Local pharmacies that are receiving federal allocation are giving out vaccine, and those include Costco, Safeway, and Albertsons, and I believe Walgreens. And so we recommend that if, people can go to the pharmacies or they come to the Town Toyota Center if they qualify for the current phase, that they do so as soon as they can. And they can still register through PrepMod for the Town Toyota Center, and call ahead to the pharmacies to see if they have vaccine available.
There's a myth going around that it has to do with the vaccine causing infertility.
So currently the only way that the vaccine could cause infertility would be actually through the COVID-19 disease itself. And there has been no evidence that that has occurred. Now, there are hypotheses and theories that affect it, but that's only for very severe COVID, where people are in ICUs and very, very sick. But that is a tertiary effect or a third part of being sick. So if you want to prevent getting very, very sick, you get the vaccine. And the vaccine does not affect fertility in any way. But COVID-19 nor the vaccines have any effect on reproductive organs. There's been no evidence that they do.
There's a lot of people coming from other countries, from Mexico, Honduras, and they come to our city, to Wenatchee. And so there's a lot of people that are coming to our country, and some of them are coming in legally, others are not coming in legally, and some of them are afraid that if they get the COVID vaccine, we're gonna ask for their legal status. How are we planning on vaccinating all these folks?
Currently, if they are working within the area, they're eligible to be vaccinated here. And the Department of Health has been taking a strategy of the honor system in terms of people coming in and getting vaccinated. And so we do not ask for legal resident status and or any of those other issues. The only identification that might be asked is to clarify for your first and second dose to make sure that you're the right person receiving the right type of dose. And they'll receive a card for their first dose that can serve to help with their second dose. And in addition, our local clinical partners are also working with different populations to provide other clinics and that kind of stuff, and they'll be providing doses as well. So as more vaccine becomes available throughout the spring and the summer, there'll be more opportunities for people to get it at their local care providers.
So we have another question from Facebook. Is there herd immunity in a 50% of a community being vaccinated and 50% not being vaccinated?
So part of what we talk about in herd immunity is completely stopping any type of transmission. And as you get 40, 50, 60%, you have interruption, but not complete kind of breaking of the transmission piece within the population. So our goal is to get to the 70, 75, 80%, which brings down and interrupts the rate of transmission significantly.
What kind of enforcement is possible for restaurants and bars that are way over capacity or have been?
Labor and Industries is the organization that enforces COVID-19 precautions in local restaurants and businesses. It has to do with the safety of the workers and the people who are in those businesses. And they would be the ones who would be responsible for going through and evaluating those components. The Chelan-Douglas Health District is supportive, and we do request that all of our businesses remain within phase. And we work closely with the Department of Health and LNI in that work to support them in that process. Okay? Without any other questions, I thank everyone for coming. And we'll be doing probably another press conference next week to give a little bit more information and go from there. So thank you.